Do you ever feel a little bit baffled by menopause or wonder what's really going on with all those hormones everyone's talking about? And what's the difference between menopause and perimenopause? And how do you know you're in it? More importantly, what can you actually do to make it through this change of life more comfortably? Those are all the questions we're answering on today's episode and so much more. And I'm telling you right now, you are going to love our guest expert, Dr. Kate Naumes. She's a naturopathic doctor and a menopause specialist who also happens to be a woman over 40, just like us, which means she brings a very unique perspective to her practice. And what she has to share today is so interesting and it's so practical. And honestly, it's so relevant to every single one of us. And I truly can't wait for you to dig into this fascinating interview. Welcome to the Feel Better, Live Free podcast brought to you by Thinlicious. I'm your host, Ruth Sukup, and here we'll talk about everything from the science of weight loss to practical tips for making your health a priority in the midst of a busy life. It's a little bit nerdy, a little bit funny, and a little bit revolutionary. So buckle up, friend, because it's about to get real. Hey there, and welcome to the Feel Better, Live Free podcast. For those of you who don't know me, my name is Ruth Sukup, and I'm the founder of Thinlicious and the Thin Adapted System, as well as the New York Times bestselling author of 7 books. And today we're going to be chatting with Dr. Kate Naumes, who is a naturopathic doctor and menopause specialist about everything from menopause and perimenopause and what's actually going on to hormone replacement and the practical steps that you can take to keep your body healthy. It's an interview that covers a lot. So without further ado, I am so excited to be able to introduce you to today's interview guest, Dr. Kate Naumes. Dr. Kate, thank you so much for being with me today. I'm so glad to have you here.
Thank you. Thank you for having me.
You're welcome. So let's just start at the beginning. I want to hear a little bit about who you are, what you do, kind of all the things.
Yes. So I'm a naturopathic doctor and a Menopause Society certified practitioner through the North American Menopause Society. I've been practicing for 16 years. I graduated in 2008. I actually also have a certificate of midwifery, but I'm not a practicing midwife. And my entire career has been helping women with menstrual disorders and infertility and perimenopause, menopause. And I love continuity of care. So I work with people from first period to last period.
Oh, I love that. That's amazing.
Yeah.
Must be so fun to watch people go through all the different phases and journeys of life from like just starting out to having babies to getting older. Like, have you been doing it long enough to kind of go through the whole cycle?
I have. Yeah. The first baby I delivered is in college.
Oh, that's
Yeah.
amazing.
And some of my clients who had like 3 babies in the practice, now they're postmenopausal. So I get to see all of those things. I get to see their kids grow up. It's extremely rewarding.
That's really amazing. I love that. Okay, so let's talk about all things menopause, perimenopause, like lay it out for us. First of all, like perimenopause. What is it? How do you know that you're in it? How is that different than menopause?
Yes. Okay. So perimenopause is the symptomatic years leading up to menopause. And menopause is when our period has stopped for a year. So during perimenopause, we may have the hot flashes that everybody talks about, or the mood changes, or insomnia. Also, another sign is difficulty losing weight or quick weight gain when in the past you didn't have that struggle. And then another telltale sign is that our periods start to change. So perimenopause can last a few years, but on average, it lasts about 7 years. And what happens is our ovaries stop producing estrogen and progesterone. And by menopause, we're barely producing any estrogen or progesterone. So we have a significant hormone deprivation state.
Oh, so how do you know that you've kind of started in perimenopause? What are the like surefire signs?
There are no surefire signs for
Okay.
certain, and that's why it does help to have someone who, can help you identify it. But usually it's that your menstrual cycle starts changing. So if you were a classic 28-day cycler or a classic 32-day cycler, and now you're having random 21-day cycles or random 48-day cycles, and you're between 35 to 50, that's a pretty good indicator that you're probably perimenopausal.
Okay, I can relate to that. So,
Yeah.
can safely say I think I've
Yes.
entered that phase, which
Yes.
is interesting because all those other symptoms you talked about, we usually associate those with menopause, but you're saying like have those symptoms more subsided by the time you actually stop having your period when you're in official menopause, or do they keep going for
They
longer than
keep going. Yeah.
joys?
Yes.
The joys
Yeah,
of woman.
exactly. Right. And some women will start to feel better. So what happens in early perimenopause is our hormones start being more erratic, especially our estrogen. So we'll have high estrogen days, low estrogen days. We might have more headaches because our estrogen is changing. We might have more mood changes. And then as we get closer and closer to menopause, when our period is stopping, then everything's just declining.
Starts to plummet. Okay.
Yeah.
So how does that impact weight loss, right? How does that impact? Because if your hormones are all changing, what does that do? What does that do, like from a weight loss perspective?
Yeah. So estrogen is extremely important for maintaining a healthy weight. Estrogen helps us have a faster resting metabolic rate. So we burn more calories at rest when we have healthy amounts of estrogen. So as our estrogen is dropping, our resting metabolic rate, our ability to burn calories at rest goes down. So that's one reason we can have weight gain. Also, estrogen, when our estrogen is low, we're more likely to gain fat around our tummy versus fat around our booty and our thighs. And that visceral fat around our tummy is more dangerous for cardiovascular disease, heart disease, and diabetes. So, again, as we're going into perimenopause and menopause, our estrogen is dropping and we're gaining more weight around our middle because of the low estrogen. Estrogen is also anti inflammatory. So, as you lose your estrogen, you become more pro inflammatory, which can impact weight gain as well as other things like cardiovascular disease and diabetes. And then also, our testosterone is very likely to drop in perimenopause, menopause as well. And testosterone impacts our ability to build lean muscle mass and also impacts our resting metabolic rate. So, those are some of the big reasons that perimenopause, the hormonal change of perimenopause, leads to weight gain.
So basically, everything's working against us.
Yeah. Oh, and another interesting thing, which I've listened to a lot of your podcasts, when we have low estrogen, we have less microbiome diversity. So,
Mm,
both in our vaginal tract, we start having less good bacteria, and in our gut, our good bacteria diversity goes down as well. So, estrogen is also really important for gut bacteria and the diversity of our gut microbiome, which also impacts weight gain.
interesting.
Yeah.
So, how do you like? What do you do? Like, what's the first line of defense, do you think, when it
Yeah.
comes to dealing with all of these hormonal changes that are happening in your body? Certainly, there's probably lots of different things that you can do, but like, where do you start?
Yeah. In my opinion, and I'm a naturopath, so I love exercise. I love diet. I talk about it with every patient at every visit for the last 20 years.
Yay.
Yeah. When your hormones have disappeared, that's the first step. You've got to replace those declining hormones, not only to protect against weight loss, but to protect against dementia and bone density loss and cardiovascular disease. So, when my patients come to see me and they're between 35 and 50 and they're struggling with these symptoms that we talked about, I am going to replace hormones first. And they will feel more motivated. Estrogen also helps with motivation. It helps balance our moods. So they're going to feel more motivated. Their mood's going to feel more stable. They're going to see more results from the efforts of their dietary choices and their exercise choices. Um, they're going to see less insulin resistance, which I hope we get into. So I start with hormone replacement therapy, and it's extremely safe and extremely effective. And it takes about like 6 months of meeting regularly to get someone on the right dose when their hormones are really erratic. And then but almost immediately, they'll start feeling better and getting better results from their lifestyle choices and habits, healthy habits.
So, how soon should you start with hormone replacement therapy? Like, is that something that you don't do until you've actually hit menopause, or is it something that is helpful even when you're in perimenopause?
That's such a good question. If people take away anything, it's the answer to this. Start early and start early in perimenopause. So the data shows that if we start before 59 and we start closer to the beginning of perimenopause, we respond better. So estrogen is better at prevention than cure. So we still want to, and we want our estrogen to be able to keep our blood vessels nice and healthy, to keep oxygenating our brain. So start early once you start having those early signs of perimenopause, and a qualified practitioner can help you identify that.
And
When you wait longer, you're not going to get as much benefit and you're going to suffer for no reason.
huh. So if you've listened to this podcast, I'm
Yeah.
pretty anti big pharma.
Yeah.
So tell me how this is different than just like popping a pill.
Yeah. Well, one, if you go to someone who's well trained in hormone replacement therapy, and I'd like to say that when I'm working with young women, I'm almost always managing their hormones without hormones because you can do it so effectively because your ovaries are still alive and they're working well. But as we age, our ovaries are literally dying. So it's not popping a pill per se because we actually recommend transdermal bioidentical estrogen,
Hmm.
which means through the skin instead of orally. And
Okay.
if you look at the data and the research, oral estrogen has more of the risks associated with estrogen. And because of the first pass effect through your liver, it's going to have more risk for clotting that we've heard about and gallbladder disease that we've heard about. And you have to take higher doses. Transdermal estrogen is extremely safe. It goes through the skin. It's giving physiological doses of estrogen, the same you would have when you were a healthy 20 and 30-year-old. And it's just replacing what is no longer being made by your ovaries. So I think what's unique about me as a naturopath is that I'm so attentive to the evidence and I want my patients to get the best possible care. And I truly believe that a combined approach with well applied medicine when needed, in conjunction with lifestyle habits for your whole life, is really the best. And when I was practicing, like I'm 45, almost 46. When I was practicing in my 20s and 30s and doing mostly like fertility and polycystic ovarian syndrome and endometriosis, I was not doing a lot of hormone replacement therapy at all. And my patients that were older were coming to me and saying, what should I do in menopause? And I said, I know what the research is, but I haven't been through it and I just don't know. And then when I started to go through perimenopause and really put my thinking cap on and put my biochemistry degree with my 15 years of practice and all that I know about health, I was just extremely convinced of the evidence that we need to replace the hormones that are gone or our body just can't work right.
Hmm.
Yeah.
So have you, this is kind of going to be a weird question, but like when I
Mhm.
was in my 20s, right, and just
Yeah.
with my husband and we weren't wanting children yet, so I went on birth control. I had
Yeah.
a really bad reaction to it, right?
Yeah.
Like was horrible to the point where we're like, get like just we will
Yeah.
take our chances.
Yeah.
And so that has always made me like worried
For
about
sure.
like later now that I am in perimenopause and probably should start thinking about this. But I'm like,
Yeah.
oh, what like how does that affect it? Is it the same? Will you see those same kind of results, or is it a totally different thing?
That's another really good question. Okay. So when you're in your 20s and somebody puts you on the pill
Hmm.
and they don't follow up when you don't feel well, many women feel great on the pill. Those are not the people who come to me. The people who come to me are the people like you. My doctor put me on the pill and I felt horrible. And I see those kind of people every day. So this is a question I get asked a lot. Sometimes they were put on the wrong pill. Sometimes they needed to be on B vitamins. Sometimes the pill was not a good fit for them for other reasons. And we need to get to the bottom of all of that. And I think that a problem with mainstream medicine, and I don't blame the doctor, I blame the system, is we have really fast visits with our doctors that last 5 to 15 minutes, and we don't have time to really ask the questions that we need to ask. And so if I had seen you then, I would have wanted to follow up with you, known exactly what didn't work for you. Were you bleeding too heavy? Were you bloated? Did you have headaches? Did you have weight gain? What were the things? And then we would have figured out why it didn't work for you. And I would have educated you as to why that pill didn't work for you and what to do next.
I was
So I
basically crazy.
Great. Yeah, right. So emotional changes are a big one. So you may have not been a good fit for a combined estrogen progesterone pill. You may have just needed a progesterone, or you may needed something entirely different, right? So now to the question of, will you feel crazy on transdermal
Yes.
hormone replacement therapy? Probably not. Probably you will feel more mood stable than you've ever felt.
Interesting.
um, it's pretty amazing. So the pill is mimicking a cycle, right? So it's mimicking more fluctuating hormones. But hormone replacement therapy is providing steady state hormones. So you take the same amount of low dose estrogen in a steady state format. When you take it oral, you can't get as close to a steady state as you can with transdermal. So that's one really nice thing about transdermal. But also, the pill is meant to mimic ups and downs more like a cycle, whereas the transdermal is just the same all the time. And then you're taking the same amount of progesterone every day. So you actually have steady state hormones. So I would say almost every patient that I see reports more emotional stability, whether they have a history of anxiety, depression, irritability, postpartum depression, a mood disorder. And that's kind of one of my subspecialties is menstrual disorders and mood disorders. So I do see a lot of that in my practice too.
Interesting. So
Yeah.
it sounds like that's a great solution for most people, but do you ever see that like the negative effects or have you had any experience with that with your patients that have not responded well to it? Is it like across the board you're like this is a miracle drug or something
So
else?
so far, when used correctly, hormone replacement therapy in perimenopause doesn't feel like a miracle drug, but it feels like a really great drug. It feels like an incredible medicine that has a incredible safety record and works really well. And
Hmm.
then you replace the estrogen, and then there's less inflammation. You're storing fat where you should be instead of in your tummy. You have a better resting metabolic rate. You're more motivated to make lifestyle changes. And then that's just hanging out in the background. And then we can get to the real work of what are the lifestyle changes? What are the dietary changes that need to be made? And if you went into perimenopause already having those good habits, and you're like, oh my gosh, I'm already eating enough protein. I eat healthy fats. I manage my stress. I exercise regularly, but I don't overdo cardio. I do strength training. I take probiotics. And you hit perimenopause and you gain 25 pounds. It truly feels like there's nothing else that you can do.
Yes.
I don't drink alcohol. I don't have processed sugar, all of those wonderful things that you talk about,
Hmm.
which I am such an advocate of. And then you replace the estrogen and they go back to their normal, healthy set point. Or you have the woman who never learned the good lifestyle habits. She's already overweight entering perimenopause and now it gets worse. We have to do both. So we have to work on the healthy lifestyle habits, but the hormone replacement therapy really helps to keep the ship from sinking.
Yeah, it sounds like it. So it also
Yeah.
sounds like if you are right starting to make those changes, if you haven't made the changes but you start making the changes, you see a little bit of impact and then you plateau, which happens, right?
Yes,
It's probably like this might be the next step to try as well, or maybe
exactly.
it's the first step.
Yeah, right. Depends. Yeah.
So let's talk a little bit about like some of the health risks of being overweight because I think that
Yeah.
those, they're not always things we want to talk about. Sometimes it's all about like fitting into our skinny jeans, but
Right.
the reality is that it's not just about losing the weight to look good, right? That's
Right.
like one great benefit of it, but let's
Yes.
talk about like what are the other things that put you at risk when you're not addressing both the lifestyle and the hormone aspects and that are causing you to be overweight.
Yeah. So cardiovascular disease, if you lose about 5 to 10% of your body weight, you decrease your risk for cardiovascular disease. And then I have a list of things that I kind of want to say because it's so cool. Weight loss helps you balance your blood sugar. So, in medical speak, we say it reduces hyperglycemia. It improves your cholesterol, so specifically your triglycerides, your LDL, and your HDL. It improves your blood pressure. It improves your liver function. It decreases fatty liver disease, and it decreases your need for medications like high blood pressure medication, type 2 diabetes medication, and cholesterol medication. So, just weight loss improves our risk for cardiovascular disease across so many different parameters. I mean, that's huge just in and of itself.
It is. It's so
Yeah,
huge.
yeah.
And
And
so what about cancer?
yeah, so it also decreases your risk of cancer to be at your ideal body weight. So many cancers are connected to obesity, and I think your audience would really be interested to know that breast, uterine, and ovarian cancer are all connected to being overweight.
Oh,
So
wow.
again, that's why your message is so important. I mean, like you said, we want to be hot, we want to be sexy, we want to fit in our skinny jeans, we want to look beautiful when we go to the party, and caring about being in a healthy weight range is important for our long-term health. You know, if we want to live
Yes.
into old age and be able to go on a bike ride in our 80s and enjoy our grandkids, and it's so
Feel good.
important. Yes, just feel good.
Yeah.
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 And
We
then
talk about that all the time in our program because so many people start, right? Because we market it as a weight loss program because you have to
yeah,
market it as a weight loss program
of
because
course.
that's typically what people want. But you come in and all of a sudden you realize, like, oh, I actually feel good. Like it's not even about the weight anymore. It's about like I feel better and I feel younger and more vibrant and have more energy than I have had like forever just
Yeah.
because I'm starting to make these changes. And I love that like like I'm kind of mind blown right now because probably because I'm like experiencing this phase of life myself, right? But like the hormone piece of it can make such a big impact and make everything else that you're doing with these lifestyle changes, which are essential, which you need to make the
Yes,
lifestyle changes no matter what, right?
absolutely.
Like they are the thing that are going to keep you living long and healthy life and have all
Totally.
the energy. But man, if you can ramp it up with adding this piece in, that's pretty exciting.
Yeah, exactly. And then colorectal cancer too, which is a big deal, is another thing. And then other benefits of weight loss are improved mobility, decreased chronic pain, decreased joint pain, decreased dementia, and decreased gallbladder disease.
Wow. So
Big
basically
deals. Basically everything. I mean, chronic disease is linked to being overweight.
so what like let's talk a little bit more about the science behind why it's so hard this like during this time of life, right? Like why
Yeah,
does everything just get so much harder?
right. So it's really what we talked about, but I'll kind of say it succinctly. When our estrogen drops and our testosterone drops, we become pro inflammatory. We don't build muscle mass as easily. Our resting metabolic rate gets slower, so we don't burn calories at rest as well. When we have less lean muscle mass, we don't burn calories at rest as well. And then instead of gaining fat on our booty and our thighs, which is totally fine for our health, we gain weight around our tummy. And that's visceral abdominal fat. And that's the dangerous fat that's connected to cardiovascular disease and diabetes. And then on top of that, estrogen is really important for our blood vessels to be healthy and like nice and soft and pliable when they're contracting and moving. So when we lose estrogen, basically our blood vessels become more rigid. So after menopause, women so before menopause, women have much less cardiovascular disease than men of the same age. But once we go through menopause, our risk for cardiovascular disease becomes the same. And that's because our estrogen is gone. So now we have just as many strokes as men, just as many heart attacks as men, and just as much cardiovascular disease, heart disease as men. And that's really because of all of those beautiful beneficial effects of estrogen.
Wow. So when you start taking the hormone replacement, is that
Mhm.
something that you have to take for the rest of your life to keep that going because you're not producing it anymore, so you have to maintain that for the rest of your life, or is there a point where you're like, okay, I'm good, I'm stabled out? How does
Yeah,
that
that's
work?
a great question. So for bone density, for example, which women women suffer more from fractures and then the consequences of bone fractures than almost anything else. It really ruins our quality of life, and we're very likely to die the year after a serious fracture in our old age. So, the few years before menopause and then after a few years after menopause is when we have our biggest bone density loss. And by taking estrogen, we prevent that bone density loss. But once you are off the estrogen, then you will start losing bone density. Um, so for that one in particular, you want to stay on estrogen as long as possible.
Is
And you
there a
can.
point is there a point at which it's too late to start taking it? Like, say somebody's listening to
Mhm.
this, she's 70
Yeah.
years old, she's like,
Yeah.
crap, I missed my chance. Or
Yeah.
will it be helpful no matter what?
We say from the data that it's 10 years after menopause or under 65. So if you're 10 years past menopause or over 65, you need to make sure you talk to a North American Menopause Society certified practitioner before you get on hormone replacement therapy. And then they'll look at your family risk, your family history, your personal medical history and decide, well, they'll talk to you about the risk benefit, and then you'll do shared decision making and decide if it's safe for you. But that's kind of the cutoff.
Interesting. So
Hmm.
how does somebody find, because I get this question all the time, right? Because we talk about find a functional doctor, find a functional doctor, find a functional doctor, find
Hmm.
somebody who's actually going to talk to you and spend more than 5 minutes like looking at your body as a whole and looking at the whole situation and your lifestyle changes and all the things that you're doing together holistically rather than like over here and over here
Yes.
and over here.
Yes.
And so how does somebody find somebody like you?
Yeah. Well, I would go to the American Association of Naturopathic Physicians, find a doctor function to find a licensed naturopath. And then in your zip code. And then if you want a menopause specialist, then I would find either a functional medicine doctor or a naturopath that has the certification through the North American Menopause Society, that's a Menopause Society certified practitioner. And we have to study for a big test, and then we take a big test and we have to pass it, and then we have to do continuing education every year in menopause to keep that certification. So that's what I would do, is I would find someone with both a functional medicine doctor that has the menopause certification or a naturopath that has that,
Or they can just find you.
where they can find me. Yeah.
And how do they find you?
Yeah, they find me at Healthy Hormone Doctor. That's my Instagram handle. Or my website is drkateDallas.com. And that's because I used to practice in Dallas, but now I do telehealth, so I can practice from anywhere in the
Oh,
country.
so they can find you from anywhere. That's
Yep.
amazing. I love
Yeah.
that. So
Yeah.
say those again, and we'll put these in the
Um,
show notes as well. But
mhm. At healthyhormonedoctor.com. I mean, at
awesome.
Healthy Hormone Doctor for Instagram, no .com.
So how can somebody find out more about all of this stuff? Like I find that sometimes it's hard to get real information, right? Like that isn't tainted by
Yeah,
whoever, whatever agenda that's out there and based, and then things are like filtered off the internet and like it's crazy
it's
the
hard.
the access to information these days. So how does somebody
Yeah.
actually like really dig in and find out more about this?
I love the book Estrogen Matters. I can't remember the name of the author, but I love that book. It's really well written. And if you Google Estrogen Matters, it's a really good read. And then I do think the North American Menopause Society has excellent data on menopause. For example, they'll go through the evidence-based treatments for hot flashes. So the number one treatment for hot flashes is estrogen replacement therapy. However, some women can't take estrogen replacement therapy or they don't want to. And then the North American Menopause Society has gone through all of the research and gone through, like, does weight loss help with hot flashes? Which, yes, it does. Does hypnotherapy help with hot flashes? Yes. By evidence-based research, yes, it does. Does acupuncture? No. So they go through all of the different like
Oh,
herbal treatments and vitamins and
interesting.
look at all the data, and then we'll show patients what works and what doesn't based on evidence.
Oh, that's a great resource.
Yeah.
And that brings me to another question. Why do we get hot flashes?
Because of the drop in estrogen. It's a little more complicated than that. Basically, something's going on in our brain
Yeah,
where we don't regulate, we have poor thermoregulation. And part of that is due to estrogen in the brain.
interesting.
So, estrogen helps us with maintaining our body temperature. So, one of my first symptoms of perimenopause was we were living in Texas, and all of a sudden, I would complain to my husband that I could not get warm. And
Oh,
I just would get so cold, like bone chilling cold. Like I was living in, Montana in the winter, but it's like Texas in the summer. And then another day I'd feel all flushed and warm. And I was also having irregular cycles, but I was only in my late 30s. And I just thought, it didn't even register. It just
yeah,
doesn't register for women until it's pretty late. But it was like,
yeah,
oh my gosh, now if I look back, my periods are not like they used to be, not like clockwork 28 days. And my temperature regulation is all over the place. So
yes.
basically, it's
Those are the
happening in the
symptoms I
brain.
noticed as well. Yeah.
Yeah.
So
Yeah.
good to know. I'm in good
Yeah.
company.
Totally. Yeah.
But
Exactly.
I get the same way. Like either I'm so cold or I'm so hot. I'll be like,
Yes.
why is it so hot in here?
Yes,
Yeah.
exactly.
So
And I think that
I feel it. I'm right there.
one of the things that we didn't talk about is like once you get on estrogen, like what are the other things I would do? Do you want to talk about that at all? Like
Yeah.
practical tips? Okay.
Yeah.
So
Yes.
I think that all hormones are connected, right? And you talk about this all the time on your podcast. That's one of the things I loved as I was listening to all your episodes.
Uh-uh.
They're all interrelated and they're all connected. So they're all impacting each other. And we could talk about this for 100 hours and we won't. But our hormones are connected. So
Yes.
when you go through menopause, your thyroid might get off. So I also recommend that women just get a screening thyroid test if they're struggling with weight loss or weight gain. Um, I really want women to focus on strength training because of how we talked about how the testosterone can drop and the estrogen can drop. So we have to work harder to maintain our muscle mass and our bone density, and strength training is a great way to do that. And
Hmm.
I love a weighted vest.
Oh,
Um, yeah. So that's one of my like favorite tips for this phase of life is to
huh.
wear a weighted vest when you exercise. Or you're
Really?
cleaning if you're doing chores or you're working in your
Yeah.
yard, just or you're going on a walk with your bestie, like put on that
Yeah.
weighted vest and just add that to your lifestyle.
Huh. I've
Yeah.
never heard that before. But where do you even find one? Like Amazon? And
Yeah,
how
you
much
can
do
just
they
find them
weigh?
on Amazon. Well, you want to put about 10 pounds, 5 to 10 pounds, not too much.
Oh,
And they
so it's
have
not like
really,
crazy.
no, it's not crazy at all. And they have like really cute ones that you're not embarrassed to wear outside. They almost look like a cute little black corset or
Yeah.
something.
Which would be
Yeah.
ridiculous in Florida,
Yeah.
but that's okay.
Right. True. That's very true. And so I wear mine like when I'm doing chores around the house or if I'm
Yeah.
vacuuming or, going on a walk or something. And that
Oh.
just helps with bone density and turning any exercise more into a strength training exercise.
Oh, that is such a great tip. That's
Yeah.
amazing and
Yeah.
so
So that's one
easy.
of
I
my
love
favorites.
anything you can do that like you're already doing and you just make it
Me
better.
too.
That's
Yeah.
like nothing better than
Totally.
that. So
Yeah,
great.
exactly. It's like,
Any other tips?
yeah. I really prioritizing sleep. So
Mm,
I'm sure you know this, but sleep deprivation is associated with increased cortisol, which causes increased inflammation, which makes it harder to lose weight, reduced glucose tolerance, insulin sensitivity, and decreased energy expenditure. So when we don't sleep well, we have a harder time losing weight. So for some people,
yes.
it's easy. You just prioritize it and then you sleep. But for perimenopausal women, not so
Not
much.
as easy. No.
No. And I bet you know what my number one answer is going to be to help with sleep in perimenopause. Hormone
Do I?
replacement therapy.
Oh, well,
But
yeah, obviously.
yeah, but that's just because of a lot of women aren't sleeping because they're waking up to pee or they have hot flashes
Mm,
or maybe they're
mm.
drinking alcohol at night. So obviously
Also
quit
me.
ditch the alcohol if you also crave alcohol more when you go through perimenopause, which is really interesting.
Really?
And that's another
Huh.
awesome thing about hormone replacement therapy is it helps with those cravings.
Oh, that's interesting.
Yeah,
Very
because
interesting.
alcohol is raising our dopamine. So it makes
Mhm.
us feel really good right when we drink it.
Mhm.
And, maybe we're feeling unmotivated, maybe we're feeling down, and we drink alcohol and we get that immediate dopamine boost, and we feel better. Long term, it actually makes the whole situation worse. But when our estrogen starts to drop in perimenopause, estrogen directly impacts dopamine. So low estrogen leads to more low dopamine, leading to more desire for alcohol. So when we correct that estrogen, we don't crave the alcohol as much as what I see in my practice over and over again.
Interesting.
Yeah.
Interesting. And
Yeah.
I agree with you that sleep is so important. I talk about it
Yeah.
all the time on this podcast. And every time I talk about it, I'm thinking like, yep, I know I should be getting more sleep. Like every
Yeah.
time I'm saying it, like the words are coming out of my mouth. Like that is so it's so hard for me to
Yeah.
get to prioritize sleep. And it's not that I go to bed on time. I'm not like a stay up late kind of person, but I'm
Hmm.
such an early morning person that I've
Mm.
trained my body. Like I can't not wake up at 3 a.m. and then
Yeah.
just every day I'm like, I should sleep. I should really sleep until at least 5, but no.
Yeah, totally. Right. And some women in perimenopause, well, a lot of women start having that early morning waking because of how estrogen is impacting cortisol. And then we wake up at
Mm,
like 3 with racing mind and we can't fall back asleep.
yes.
So if
So
you're
you're saying the
struggling,
hormones are going to help with that.
yeah. And of
Does
course, there are
it
like amazing supplements too.
does it
But
stabilize out your periods too? Because I must say I find the irregular periods because mine come so frequently now that I'm like
yes,
annoyed all the time.
yes, I
Does
know.
it
I don't even
stabilize
think
that
about
out?
100%, 100%. Yeah. Yeah.
Okay, well
Not
that's a
even,
good enough
yeah.
reason right there.
Yeah, for
No more
sure.
20 day cycles.
Right, isn't it the worst? It's
Oh,
like I
the
had no
worst.
period for 20 days, then I bled for 10, and then I had no period for only
Yes.
20 days, and then I bled for 10.
It's yes,
Yeah,
yes, it's very annoying. I
for
get it.
sure.
Oh my
Yeah.
goodness.
So
Okay.
prioritizing sleep and
Yes.
then taking probiotics
Okay.
because of the importance of the microbiome and our gut bacteria on maintaining a healthy weight. And like we talked about in perimenopause, as your estrogen drops, the diversity of your gut microbiome and your vaginal microbiome
Yeah.
decreases.
And the
So
probiotics help with the vaginal microbiome as well.
they do. Hmm.
Oh, interesting.
Yeah.
Okay.
Sometimes in rare cases, I'll do vaginal probiotics. Um,
Mhm.
like if someone's having significant recurrent infections and I've done certain things and they haven't worked, sometimes I'll do that. But usually just taking oral will help with the vaginal microbiome as well.
Okay. So
Yep.
sleep, probiotics, and weighted vest.
Yes. And
Yeah.
then check your thyroid
And check your
and
thyroid.
then boost your protein intake. And you
Mm,
talk about this all the time. It's
yes. More
way
protein.
harder. Yeah, it's really hard for women to do.
It is hard. I
Yeah,
think it's our society has made us so protein averse. It's the
it's so
craziest thing.
weird.
I
Yeah.
don't understand that at all. No, but
No.
basically meat at every meal. Like that's what I
Yes.
tell people. Just start eating meat at every meal. That's how you'll get
Yes.
enough protein. And if you're not, then you're
Exactly.
not probably not getting enough. So
Yeah, exactly. And like, don't be afraid of eggs. Don't be afraid of fish. Like, you have to eat protein and you have to eat way more than you think. And my tip for women in my practice is not to be like, start eating more protein right away. I just say, until our next visit, I just want you to note how much protein you're eating a day.
mm,
And the women are shocked. They're getting between like 10 and 20 grams a day,
it's crazy. Yeah.
which
And
is
that's totally normal
nothing.
because
Yeah.
of just the normal diet that we eat. It's so loaded with carbohydrates, which is
Yep.
basically sugar, and
Yep.
so deficient in protein and healthy fats and
Exactly.
full of inflammatory fats. I know. I know.
Yes,
Don't even get me
exactly.
started on that one.
Yeah, and if you wait till the end of the day to feed yourself, you're going to crave alcohol because it's a quick sugar boost.
Yep.
So protein is so important for stabilizing, satiety, which you know
Yes.
too. So protein is huge, and then eat low glycemic index carbohydrates. And really where I learned this was not in perimenopause. I learned it by working with people with polycystic ovarian syndrome.
All
So
right.
women with polycystic ovarian syndrome often have insulin resistance, and they're the client that comes in and they're like, I exercise more than anybody. I work harder than anybody on my diet. And I am so frustrated. I cannot lose weight. I cannot keep my weight at an ideal. And it's because they have insulin resistance. And so, one of the first things that we do is talk about complex carbohydrates and simple carbohydrates and low glycemic index carbohydrates and getting enough protein. And all of a sudden, their hard work starts paying off.
Wow.
Yeah.
It's
So,
amazing. It's amazing. It really does. Like, I mean, it's so simple. And I feel sometimes I feel like a broken record on this podcast because we
mhm,
just like hammer in these things. And yet you look at the society as a whole and we're not doing it. We're not
no.
doing any of it. And it's not
Mm-mm,
hard. It is
mm-mm.
not hard. Like, eat
Yeah.
more protein, eat more healthy fat, eat less sugar and fewer
Yes.
carbohydrates so that you can stabilize your blood sugar and get your hormones balanced. Like
Yes,
that,
exactly.
and heal your gut. Like
Yes,
that's it. That is the
exactly.
solution that will fix your
Yes,
entire life. That is, will
exactly.
every problem that ails you is pretty much solved
It's
by
true.
that.
Yeah.
It's amazing. But
Yeah,
I love the
it's true.
confirmation.
Yeah, totally.
I love that we have you as a resource now because
Thank you.
like truly we hear so often from so many of our clients like how do I find like my doctor just wants to put me on pills and how do I find a doctor that is actually going
Mhm.
to work with me and talk to me. So give us your information again because I
Yes.
know so many people are going to want to reach out.
Yes. So you can find me on Instagram at Healthy Hormone Doctor. And if you'd like to hear more about perimenopause, you can DM me pod, as in podcast, to get my mini podcast. It gives you the scoop on all the evidence-based medical and holistic treatments that keep your symptoms at bay during perimenopause. So that's a good
Nice.
resource for people to find me
Yes.
and see if they like my vibe and if I'm a good fit.
I love it. I love it. And of course, we will add this all to the show notes so that you can find it if you're listening wherever you're listening. And Dr. Kate, thank you so much for being with us today. This was amazing.
Yeah, thanks for having me.
All right, guys, that about does it for this episode. I hope you found this topic as fascinating as I did. And if you know someone else who might be interested, please be sure to send it their way. And then, of course, be sure to leave a review on Apple Podcasts or Spotify or wherever you like to listen. And be sure to subscribe to the podcast to be notified of future episodes. And then I will see you back here for another new episode very soon.